Welcome to our YouTube channel. Today, we are going to be speaking about public safety. My name is Meda DeWitt, and I'm running for governor in the 2026 midterm elections for Alaska. And with me is Chris Steer.
Hello.
Public safety is not siloed alone. There's lots of factors that build into our crime demographics. Alaska actually has some of the highest demographics for and highest disparities for violent crime, substance abuse, domestic violence, rape, sexual assault, all the things that we don't want to be number one or number two in. We are. So we need to address this in a holistic manner. Safety and our penitentiaries is one of the largest things in our budget, and it's actually one of the things that have gone most out of budget.
Private penitentiaries are known for being a racket across the United States, but they are especially bad here. And prevention is a lot more affordable than crisis. And we keep trying to fix our public safety problems on the back end, but we're not taking care of people on the front end, taking care of their mental health, taking care of their opportunities.
Right now, we have a 60% recidivism rate, and recidivism is when people leave prison but then go back into prison. People leaving the penitentiaries actually lose their Medicaid designation immediately as soon as they leave. So that means they're not able to go get their therapy or, get the treatment they need or their medications that they need. And so they actually end up right back into the system really quickly. Comparing three other states who implemented a 90-day extension for Medicaid, it actually reduced the recidivism rates by 11 to 16%. So how that pans out for us is even if we're providing those services for 90 days, it saves us almost $15 million just to do that one thing. And that's why we talk about care being more affordable.
That's just the accounting fees of, what it costs to put them through the justice system. That's not counting the harm that they would otherwise be doing, right, to themselves, to the others. And it's not counting the costs of what they might otherwise be doing productively in that time.
We have a high rate of institutionalization for our people, but unfortunately, in the penitentiaries, about 40% are Alaska Native men. And we can look at, the challenges that are faced of historical trauma, intergenerational trauma, and also the displacement from the ability to provide for the family in hunting and subsistence ways. And so acknowledging that our men across the spectrum need support, we have to also acknowledge that just recently, as 1972 was when Molly Hooch won the right to no longer have to go to boarding schools. The Alaska Native Child Welfare Act was put in 1984, and it's American Indian children as well. And we have the right then to retain children in the home and not have them taken out. They were taking kids away because the standards in the house wasn't up to the counselor's standards. When you have folks who are still living in rural communities, and some of them don't have indoor plumbing. Not only that, in 1978 was when Alaska Native and American Indian peoples gained the right to have our religious freedom. And it wasn't until 1997 that we, as Alaska Native people, took over our tribal health care. One of the things that we have to do is repeal the catch and release laws and make sure that we're protecting our vulnerable community members and taking folks off the streets that are predators or and we also have to have VPSOs that go into some of our communities. Actually, at that last administration, he took VPSOs out of a lot of the communities. And what we found out is having a VPSO in a community actually helps to prevent crime in the first place. It helps to de-escalate crime so that way it doesn't become as severe. And it saves us money because when you have troopers that fly out to a community, it actually costs tens of thousands of dollars, if not more, to get troopers out to
Just for
investigate
one
a crime.
incident.
So one to
Yeah.
two incidents covers a VPSO for the entire year. And then you're bringing in good jobs into the community. These communities are so small, you end up having teams of people working together. Like you might have a behavioral health aide, a community health aide, and then a VPSO. And so they actually help to support each other and create teams along with the community doers, and council and the mayors or village representatives. Um, so it actually allows to create a reduced burnout for the people who are in the community. And when we're talking about this, in our Alaska Native communities who have high demographics, they're also mixed. We don't have reservations. The only reservation we have in the state is Metlakatla, which is technically considered a reserve. But the rest of our communities are integrated, and we have services that are provided to Native and non-Native people, even by like the Tribal Health Consortium and their clinics. And so making sure that we have those supports in place is important. When we're talking about crime, there isn't just the cost of the VPSO, there's also the reduced ability to work or contribute by the person who's experienced the crime. And so the cost, when we're looking at how much a VPSO saves, it's way more than just the immediate tangible, right? And that's why we talk about crisis being so expensive, and prevention and planning is always more affordable. Please look at our policies that are on our website, MedaForAlaska.com/policies. You can give us an email, like we said, questions@MedaForAlaska.com, or put it into the comments, and we will continue to record this series so that way you have access to this content. So thank you very much. Ganesh.
Thank you.